Young girls and orphans in the Northwest Province are at higher risk of HIV infection. Now this, according to recent findings from HIVSA. The study found that the southern and Bojanala regions have the highest prevalence in the province. For more on this, we joined on the line by HIVSA CEO Yasmita Naidu. A very good morning to you, Ms. Naidu, and welcome.
Good morning, and thank you for having me on your show.
Firstly, tell us, what did your study find, and what are the key underlying issues you found to be contributing to higher HIV prevalence, especially in the Northwest?
Well, let me first say, Elvis, that the study was not conducted by HIVSA per se. This is based on the statistics that are available around HIV prevalence within the country. And we find that in the Northwest Province, like many other provinces in South Africa, there's still much work to be done to reduce HIV prevalence. And we do find that women in the age group of 15 to 49 still sit with a higher HIV prevalence than men in the same group. In fact, 14.5% of men only have HIV, while 25.5% women are sitting with HIV. And I think there are a number of contributing factors to this disparities in the prevalence rate. Gender inequality is one, poverty, unemployment, high rates of gender-based violence. These are all contributing factors to the disparities in the HIV infection rates between men and women in South Africa.
Talk to us about that because, the age group 15 to 49 seems like the vulnerable group for women. So how are adolescent girls and young women finding themselves to be vulnerable to HIV infections and what causes this?
Yes, like I said, I think gender inequality plays a big role. We still have many young women that are in age disparate relationships with older men, and these are often transactional in nature. So when you are entirely financially dependent on a male partner, it's very difficult to negotiate safe-sex practices such as consistent condom use. And this contributes to HIV infections in that age group. We've also found that young women still don't see HIV prevention as something that is a priority for them. Unplanned pregnancies seem to be top of mind. And I think until we don't place HIV within the broader ambit of sexual and reproductive health, the conversation around HIV sort of falls on the back burner.
So talk to us about the certificate in HIV and the Family Education or CAFE program. What is it and how do you make sure that program reach the most vulnerable and how to reach populations in the Northwest Province?
Yes, this is actually good news for us as an organization because we have been implementing orphans and vulnerable children and youth support programs since 2012 in Gauteng. So the CAFE program, which stands for Children, Adolescents and Families in the HIV Epidemic in the Northwest Province, is a USAID-funded grant that will last for 5 years. We will be implementing the program in 3 districts within the Northwest Province, Bojanala, Dr. Kenneth Kaunda and Ngaka Mudiri Mulema. And our model of implementation is unique in that we don't do the service delivery ourselves, but rather through community-based organizations that are housed within these communities where the most vulnerable reside. So for the life of the project, we aim to work with 27 community-based organizations, and these are spread across the 3 districts, which will ensure that we have sufficient reach in those 3 districts within the province.
And how will the grant then be utilized to address the socioeconomic vulnerabilities as well as the psychosocial distress that increases the risk of HIV among orphans?
Yes, so much of the grant goes towards the capacity strengthening of these organizations to be able to deliver evidence-based curricula. And these organizations' capacity gets strengthened both on an institutional level as well as from a programming perspective. And so we know that many of these organizations currently exist and are doing good work. But our interventions then make sure that the quality of services is quite high. We use a case management approach, which allows these communities to assess households assess families at a household level and be able to look at what their vulnerabilities are and then either deliver the service themselves or refer them for ongoing services to other stakeholders, such as the Department of Health or Social Development, based on what their vulnerabilities are. But in this program, the key focus is to identify children and adolescents living with HIV, to link them to treatment and care, and to ensure that they become virally suppressed.
And is there partnerships with provincial departments to support this program?
Yes, we will be signing a memoranda of understanding with the Department of Social Development and Health, as well as the Department of Basic Education. And then, of course, there are many district support partners, such as clinical partners, as well as partners that are servicing key populations, such as children of female sex workers. So it will be absolutely critical for us to ensure that those partnerships are in place, to make sure that we deliver holistic services that are comprehensive. We will also be exploring public-private partnerships to look at where the corporates in the province can assist with, closing the gap on economic empowerment by looking at whether they can support youth employment in the province.
What is the intended numbers that you intend to reach?
Well, for next year, that's the 1st of October to the 30th of September next year, our target is to reach 23,692 orphans and vulnerable children within that province.
And what is the percentage of that vulnerable group that we're talking about?
I mean, it's a fairly significant percentage, and remember, it replicates the percentage of children and adolescents living with HIV in the population. So currently we know that only 79% of that group know their HIV status, and of that 79%, only 63% are on antiretroviral treatment, and only 70% of that 63% are virally suppressed. So there's much work for us to do in terms of meeting those UNAIDS 95 targets.
I thank you so much for that update. That was HIVSA CEO Yasmita Naidu.